Good morning, Dr. Bukstein here. Thanks for taking time to meet with us. One of our care team members is on the call as well, and she'll be reviewing your asthma control plan today.
Thanks, Dr. Bukstein, for the introduction. As he said, my name is Judy with Dr. Bukstein's office. Thanks for taking time to meet with me on this secure video telemedicine appointment. Since the COVID pandemic, we as healthcare professionals have become very skilled and comfortable with engaging our patients over a secure video telemedicine appointment. And we've noticed patients really enjoy the convenience of the appointment.
Good morning. I appreciated you and Dr. Bukstein recommending that we set up a video telemedicine appointment to review how my asthma is doing. I'm very comfortable with video telemedicine appointments, and I find them very convenient. Where should we get started?
I think we'll jump right in. Dr. Bukstein had some concerns with your lung function, ACT score, and your medication use. He's concerned your asthma is not well controlled. A recommendation for better asthma control may include changing the medications you're on. Has anything prevented you from getting the treatment you need for your asthma from me or anyone else?
Well, now that you mention it, yes, two issues come to mind. The cost of the meds can be challenging, and because I have several different medications I take, I'm always making trips to the pharmacy, and it creates confusions on what I need refilled and what I just got refilled. Can you help?
Let me address both of those issues for you. I think we can reduce the number of trips you're making to the pharmacy. After this appointment, I'll sit down and take some time to synchronize your prescriptions. Synchronizing means that we'll make sure that a new prescription for all of your medications starts and ends on the same date 1 year later and have multiple refills to last you throughout the year, so as not to delay your picking them up at the same time each month at your pharmacy. Also, if your insurance allows for it, we may be able to have your prescriptions as a 3-month supply with 1 year of refills that send to you every 3 months free by mail. Usually that saves you money. This should make it easier for you and address the cost of medications interfering with your ability to treat your asthma. Overall, how satisfied are you with your asthma care?
It's okay. If I had to rank my asthma care on a scale of 1 to 5, 5 being great, we're about at a 2.
Well, that's not good. Let's see if we can take that 2 to a 5. One option may be biologic.
I've never heard of a medication called a biologic. Are they new?
No, actually, biologics have been around for many years and they're very safe. This is where a periodic review of your medications and your preferences from time to time is important. Circumstances change and new medications become available. What I'd like to do now is have a conversation with you about your asthma control, your health beliefs, and personal preferences on how you manage your asthma and how it's currently being addressed. The process we're going to use is called shared decision making. The shared decision making process has been developed to allow me to share current medical research and trends with you and to ask you some detailed and personal questions so we can discuss options for treatments using the best medical facts and incorporating your personal preferences into the decision. During our conversation, we'll also use something called a shared decision-making tool or aid. This will help us walk through the process. Do you have any questions or concerns at this time?
No, this seems exciting and straightforward. I want to figure out what's best for me so I can get my asthma under control.
Now I'm going to walk through using a shared decision-making tool for severe asthma with you. We can walk through it and work through it together, and I'm here to answer any questions you have along the way.
The clinician, a medical assistant in this case, attempts to enhance the patient's motivation to increase inhaled corticosteroid adherence using motivational interviewing techniques, such as assessing the patient's level of readiness to change and reasons and motives, as well as using empathy and concern and acceptance of the ambivalence about increased inhaled corticosteroid adherence. In this step, the clinician may elicit the patient's belief regarding the risk and benefits of their current self-management approaches.
End of the
You did great with the SDM for severe asthma tool. Did you have any questions, or is there anything else you would like me to cover in more detail?
None. The SDM tool was great. It really explained everything to me. It was easy to understand and had some great pictures to help explain some of the more difficult concepts. I didn't expect so many questions based on what I want. Thank you so much for taking time to go through it with me. I understood everything that was being asked, but having you to review and clarify just made me feel better. No doctor's office has ever done anything like this with me or my family before. They usually just tell us what we should do.
That's really great feedback. It feels like this was a valuable exercise. Based on what you learned and your preferences can we depend on you to come to our office for a monthly injection?
Yes, absolutely.
Great. Now that we've gone through the SDM tool and discovered your preferences, I'd like to have Dr. Bukstein review the shared decision-making tool results with you.
So, after reviewing shared decision making tool information, do you want to stay on your current medications or try the biologic that you picked from that shared decision making tool for severe asthma? When I looked at your medical records before, I see that you've been into the emergency department twice over the last year. If you can commit to taking your medications at least 75% of the time and a monthly trip to the office for an injection, you'll be less likely to have serious asthma attacks, and you'll be able to play tennis and not miss out on activities with your kids. Will that work for you?
This is very doable. I don't want to miss any more time with my friends or my kids. How can we get started?
I'd like you to think about it over the next few days and then call my office to schedule an appointment to begin therapy. Do you have any more questions?
No, I'm ready to get started. Thank you guys for taking me through the process. It was really helpful to understand everything.
No problem. You have a great day, and let us know if you need anything. Goodbye.